seamless upload of the presentation. So I'd like to welcome everyone on behalf of the Safeguarding Adult Board. And we've got a fabulous turnout today, 55 of you in the room so far, so that's brilliant. I'd like to request that everybody kindly turn your cameras off and microphones off for the session. Should you have any questions later on, if you'd like to raise your hand, that would be really great. If you'd like to use the chat function throughout the session, there'll be a few delegates on hand to be monitoring the chat and making sure that any questions that come out we're able to answer. There is an option in Teams to use live captions, and these will be switched on by individuals only, so only you will be able to see the captions. They won't appear for the whole group, so that makes the presentation more accessible for those who may have difficulty hearing either Julia or I. Just to let everyone know, this session is being recorded and the recordings will be made available through the Keeping Bristol Safe Partnership website, and your local Safeguarding Adult Board will also have links to send out. There'll be an evaluation at the end of the session, and that will be shared through a live link in the chat. So if you'd kindly complete before leaving, that would be greatly appreciated. It should only take a couple of minutes, so thank you all for attending. Now over to you, Julia.
Hi. So my name's Julia Mason. I'm a designate nurse for Safeguarding Adults in the Somerset ICB, and we were tasked with coming up with a presentation around how do we listen effectively when working in partnership to safeguard adults. So we had a thought about it and we decided that we were going to structure our session in the following format. We wanted to give it some thought really about how do we as practitioners listen effectively, and what do we consider is an effective way of listening in a multi-agency working, but also making sure that we're applying the principles of making safeguarding personal and ensuring that we're listening effectively also to the people that we're working with to safeguard. So therefore, we look towards the learning from the recent national SAAW analysis that covered the time frame of 2019 to 2023, because within that there was an analysis of learning from the SAAWs regarding multi-agency working. They covered over 100 safeguarding adult reviews across that 4-year period. They looked at what worked well and also considered the areas of improvement. And we took that the points around the areas of improvement and considered this and how it impacted us on practitioners and our ability to listen effectively and understand the whole safeguarding practice. We then thought we would share how we've developed practice in Somerset, in part in light due to the SAAW analysis, but also through more local learning from SAAWs and the recommendations that resulted from that. We previously had a document called What to Do If It's Not Safeguarding, and recognised the need to review this documentation to improve how we as agencies listen effectively to each other, but also to those that we safeguard. We developed our own version of a multi-agency risk management meeting process, and in lieu of any national guidance, in fact that there is no national guidance on how this should be carried out, we also touched on how our MARM has worked effectively in practice, and we've got an example of that Kate's going to run through later on in the session. We also then will finish off with setting out how we are continuing to develop our MARM process and some learning that we've established through some multi-agency discussions that have been taking place across the Southwest. So that is the plan. So starting with the learning from the Safeguarding Adults Reviews Local Government Association funded review, It was an analysis that built on the findings from the first national analysis, which was published in 2020, and it considered the learning from SAAWs completed between 2019 and 2023. The analysis has provided a significant knowledge base about adult safeguarding in England across all types of abuse and neglect, and it highlighted both shifts that have taken place and challenges that endure from the first analysis through to the second analysis. In the second stage of the review, the analysis was split into 5 domains, and one of those focused on multi-agency working, which covered multi-agency risk management meetings. It considered the fact that these meetings were held by and were referred to by a number of different names. In one case, a SAAW notes indicated that a multi-agency approach to information sharing about missing persons was through a long-term missing panel, and that was considered quite innovative and commendable. A number of SAAWs also considered and mentioned MARAC meetings, which facilitated identification of domestic abuse. There were routine multidisciplinary meetings in GP surgeries, which were really good at sharing and listening effectively to care homes and staff and residents. There was an example of a safeguarding team holding daily huddles, which had a really good multi-agency attendance. And in another case where there were strategy meetings, and strategy meetings were seen as key to facilitating a network's ability to listen to each other effectively. However, essentially, all of these types of examples led to agencies coming together to discuss needs, risks and risk management with the aim of developing shared understandings and shared intervention strategies. So we think, great, we've got it cracked. However, unfortunately, due to the inconsistencies, there were a significant area of improvement that were identified. As part of the analysis as well. And that started with, a common feature was the absence of any multi-agency meeting where information could be shared, risks assessed, and a shared risk management strategies were able to be put in place. Sometimes risk strategy meetings weren't called at all, or weren't called in a timely way, and at other times they had taken place but without the involvement of key agencies. In some cases, minutes weren't available to the missing agencies. In another case, the meeting stopped when the person turned 18. And there was sometimes a misunderstanding or a muddle about which procedure should be followed in which circumstances. And there were comments from practitioners about different types of meeting that could be confusing, and their specific purposes weren't always clear. Some areas lacked an agreed pathway or format for such meetings, and in other places there was no custom and practice around that use. And practitioners have said that neither the infrastructure nor organisational culture existed to ensure consistent use of multi-agency meetings, which would include decision making about lead agency and key worker, and a review of outcome of agreed plans. So another learning point was that actions did not appear to have been driven or owned effectively enough, and as such there was insufficient rigour and drive to the plan, or recommendations for actions were not consistently adopted by the agencies to whom they were ascribed, and the intended outcomes of the plans were not achieved. So quite a significant area of learning around how practitioners were working together but weren't listening as effectively as they could be. So in essence, the absence of such meetings meant that there was a lack of shared ownership, a lack of challenge between agencies, and safeguarding processes lacked oversight. The complexity of safeguarding picture was not understood. There was a case where self-neglect was seen to be an issue, but ongoing exploitation with NIST. Another example was given where mental health staff were not involved to a children's services strategy meeting, resulting in vital information not being shared. And the adult child safeguarding response remained fragmented, and the lack of shared strategies was evident in multiple safeguarding adult reviews. Several agencies, another example was given where several agencies did meet together to share information, but one key service was not part of that meeting or involved in any updates as the individual's risk factors escalated. So they weren't aware of that person's increasing vulnerabilities and risks. They were not advised that she had been discharged by mental health services due to non-engagement, or that she was being served with an eviction notice. And this just led to a lack of coherent support for that individual. In some cases, there was disagreement over ongoing plans, but there was no follow through. And all of this sort of led to the fact that practitioners weren't listening effectively together. Sorry, I don't know why it's so responsive. So we considered multi-agency risk management meetings. Now, this is a term that we use within Somerset, and we are aware that there are other phrases that are used across the region and indeed nationally. But we considered the fact that it was key to good safeguarding practice. We'd realised that within our own learning from safeguarding adult reviews that we needed to have a clearer process from our pre-existing version document, which was what to do if it's not safeguarding. We recognise that multi-agency working and information sharing is crucial as long as we've got clear and open communication processes. So we considered the introduction of a MARM process would provide us with those clear mechanisms for managing the overlap between processes and approaches so that we could safeguard people effectively. And it would also promote a joint approach across organisation to assessment and management of risk of adults with care and support needs plus complex needs. When and why would we use this approach? So we considered that it was likely to be useful to any professional working with an adult who is experiencing an unmanageable level of risk. And as a result of these circumstances, they create a risk of harm, but don't relate to necessarily abuse or neglect by a third party. So we were considering in particular cases of individuals who are suffering from self-neglect, but that is not the only reason we would utilise a MARM process. We also wanted to ensure that the process actively engaged with the making safeguarding principles. So we wanted to be ensuring that we were listening very effectively to the individual that we were worried about and that they were key to the process as we developed it. So then we thought about, well, when shall we use the MARM process? Where does it sit within the statutory process of a Section 42? And it can happen at any time, is essentially what we found. It works well for that early intervention stage where we're working proactively in a preventative manner to try and address concerns that we might have that don't yet meet the level of requiring a safeguarding referral. The consideration of holding a meeting at that point to effectively share information and discuss with the person that we're worried about what we're worried about at that point to make sure that we're all working together to address the right outcomes for that individual. If we are at the point where we feel that we need to make a safeguarding referral, again, at that very point, we should be considering making holding a MARM at the same time. And that's because risk management doesn't stop just because you place a safeguarding referral. It's important that a MARM is carried out so that we can support and carry on ongoing risk assessment. And it will give us a clearer picture of what is carrying on for that person whilst we wait for the outcome of a Section 42 referral. And then if the referral is unsuccessful and it doesn't meet the criteria for a Section 42, again, we can be holding a MARM meeting. Anybody can be setting that meeting up if we get the feedback from the local authority that the concern doesn't meet the need for a statutory process. Who can call a MARM and who should attend? Now, this is really, really important and has been identified that this is not an adult social care led process. This is a multi-owned and held process. Anybody can call a MARM meeting. Anybody should feel capable and confident of calling a MARM meeting. People seem reluctant to get involved in the process because they're worried that they will then take responsibility. But that's why it's important within that first meeting that a discussion is had about who the lead professional should be moving forward. We also need to think about who is appropriate to invite. Now, you may be worried about inviting the individual that you're concerned about to the meeting, and you may not feel comfortable about sharing all of the information that you have in the presence of that person. That might mean that you have a two-part meeting where there's a little bit of risk information sharing prior to the individual also attending, but it's so important that the individual themselves are involved in that process, that they get to hear what professionals are worried about. And we also, more importantly, get to hear about what's important for that person and what outcomes they want of us being in the room and listening to them and them listening to our worries. It may be that there is appropriate to gather some information ahead of the meeting, because they might not be able to attend, or they don't think that it's relevant for them to attend, but it is also important that those agencies get feedback following that meeting. There is a multitude of people that should be invited to that meeting, and we've listed some here on the slide, but that is not an exhaustive list. It is important to try and think about who is involved in that person's life, who might have a view and a perspective and some information. Who is it most important that we give the opportunity to listen to within this process? If the individual themselves is not able to attend the meeting, does not want to attend the meeting, or cannot attend the meeting, maybe because they lack capacity to contribute to the meeting, then who would be the right person to represent that person at the meeting? Do you need to consider advocacy involvement and have them attend the meeting on the individual's behalf? And what is really, really important is that there is a follow-up meeting set. This is not a one-off process, and you don't set actions if you don't have a meeting that can be then in place to follow up those actions. As I say, within the meeting itself, we need to be clear regularly within the process about who is the lead professional and agency. And again, that can change multiple times as the person's situation changes, evolves through the support of the agencies or because of the circumstances that they're experiencing. What's also important that it's clearly documented what the concerns and risks are. And within the follow-up meetings, are you measuring how those risks and concerns have changed, or are indeed there new risks that have been identified as people continue to work with the individual? It's really important to clearly record the views of the person and or their representative. Very important to capture their story, their understanding and their views. Also important to record whether they have concerns about that person's capacity. They may lack capacity, but that doesn't necessarily mean that we should be discounting their views and wishes. But it's very important to capture that within the meeting process. And also, if you haven't got all the agencies round the table at your initial meeting, record who you think should be at future meetings, why their input is important, and make sure that that is documented. And now I'm going to hand over to Kate, and she's going to talk about a good practice example of MARM within Somerset to show how the process worked.
Interestingly, if you look back up through the comments, Amanda Toogood from our Safeguarding Advisory Service has commented saying, I think adult exploitation is not always recognised, and some of this is around the language we use with adults about unwise choices. The MARM meetings work really well for adult exploitation in my experience. And it is actually Amanda's experience that we're sharing today. With an example of good practice. Now, this was a MARM that was held for an individual who was identified as having extremely high risk of abuse and exploitation due to their additional needs. This was an individual who had, to coin a new phrase, transitioned from child safeguarding mechanisms in place due to exploitation that they had experienced as a child and were now receiving support through adult services. Now, this individual did have a history of refusal to engage with services, which kind of led to an additional challenge in terms of how we make safeguarding personal, how this whole process enabled that individual to feel a sense of autonomy with the decisions that were being made on their behalf. There were complex and diverse needs spanning across multiple agency criteria, so there was an awful lot of agency support in place already for this individual. So there was a lot of information to share within this MARM process. There was a combination of domestic violence, mental health, and substance abuse, all prevalent in this individual's life. Now, as a result of the exploitation and their own learning difficulties and additional needs, there was evidence of risky behaviour to self and to others for this particular person, and potential risks relating to consent to medical treatment as well. So lots of things to consider within this MARM meeting to put in place a safeguarding individual intervention that was personal to this individual. This was a particularly well attended MARM. There were several professionals present, all of whom were extremely relevant in terms of making decisions to put in place a safety plan for this person. The early intervention worker was present, as was their peer support worker. So two individuals that have been working with this person for some time. Clinical service manager and ward manager representing the health aspects for this individual's needs. I'm being quite generalistic because obviously we need to protect the confidentiality of the meeting because this is an example of real practice. The individual's GP and social worker, and there was a representative from the Integrated Care Board as well, looking at that strategic oversight of what needed to happen. Learning disability representative and adult social care representative were actually present, although not leading the meeting. As Julia said, the MARM is about a multi-agency approach where adult social care are valuable and present, but don't necessarily lead the process as they would in a further adult at risk process that could possibly take place. Within the Somerset Foundation Trust, we have the Safeguarding Advisory Service, and the Safeguarding Advisory Service are there to support advice and guidance for all members and all staff across the Somerset Foundation Trust. So our representative was there to have that oversight of all the information that had come in across the trust in terms of this individual's health needs. There was an advocate present to ensure that the individual's voice was heard and their feelings and thoughts and wants were representative. And the PCSO, local community support officer from the police. So a particularly well attended MARM process. Now, some of the things that were identified from this particular meeting that were examples of extremely good practice were the fact that the voice and the views of the individual were absolutely central to the decision making, and that was enabled by having an advocate and their peer support worker present. Because this mum was so well attended, the detail of information that was shared across all professionals, from all professionals, enabled those present to have a really true and clear picture of what needed to happen to protect this individual. The risks were clearly identified with that expertise and understanding of adult exploitation. And in terms of, as Amanda has already mentioned in her comment, the judgment and an assessment of the individual's ability to make decisions on their own behalf, and the impact of possible unwise decisions and how we could manage that as a multi-agency approach. Now, what was important here is that detailed and smart plans were made. Smart planning is absolutely key to avoid that drift. And as Julia mentioned, having those follow-up meetings with measurable kind of outcomes that you can assess as to whether they've been met or whether they may be drifting, whether we need to amend those outcomes to make them more attainable and expedient as well for that individual. We thought about the think family approach. There were several members of this individual's family that were being impacted by the exploitation that the individual was experiencing. And so we needed to ensure that everyone within that family were receiving a level of support that was appropriate for their need. And a review date was set, and the commitment from all agencies to continue with the support. So with all those things in place, this was a really fabulous example of a successful MARM where a solid, smart, targeted plan was agreed by everybody with clear actions for all to protect this individual. Okay, so I'm passing back over to Julia. So if you want to take control, there you go.
Thank you. So our journey in Somerset, we've been utilising the MARM process now for most of this year, and we consider it a ongoing, evolving process. One of the things that we've recognised that we don't have or we didn't have in place was a way to get feedback from practitioners who are using the process as to how effective they felt it worked for them. So we've established an evaluation form that is not only available at the bottom of the template document that we've provided for recording the minutes of a MARM meeting, but we've also put it in the process document and on our board website. We are encouraging all practitioners that we're made aware of that utilise the process to complete that evaluation form so that we can further tailor the guidance document to support those practitioners who might be approaching using MARM for the first time, to give them the confidence to feel that they know what to do and how to do it in the right way. We're also considering whether we can capture the use of the MARM process within our safeguarding referral form. This would give us an idea of how often MARM is being utilised and again how effective it is, and would provide us with an opportunity to get further feedback on the process. We intend to review and amend the process guidance on a 6-monthly basis. Unfortunately, we are in the position where we have ongoing safeguarding adult reviews, and a number of those are identifying further development opportunities within our MARM process. So we will take that on board and review the document in a 6-monthly cycle. We've also had some regional discussions around the MARM process from a health perspective, and I'm going to feed back in detail the findings that we had from that, or the questions that it raised, in the next slides. But what we have done with the information that we gleaned, we've also shared the inconsistencies, the findings, the learning that we've collected from a Southwest region back into the Southwest Safeguarding Adult Board's chair network and managers network, as well as feeding it back into the ADAS Southwest Safeguarding Adults lead network as well for consideration. And what we really want you to do from this session is to consider some of the points that were raised within the learning that we've established from that network of safeguarding adults professionals discussion across the region. So I'm going to just move on to those slides now. And I apologise if the writing is a little bit small. We will be sharing these slides, so you'll be able to blow them up and look at that in a bit more detail. But first of all, the questions that we want you to think about and be aware of is, does your partnership or board already have a MARM policy in place? And it may not be called a MARM, but it will essentially meet the same criteria as what we've discussed today. Are you aware of whether the partners in that partnership or board are all signed up to, aware of, and engaging in the policy? And what's important is not that people at strategic level are aware, but frontline practitioners. So if you are from a frontline practitioner role here today, are you aware of this process or something similar within your area of work? Do you use it, and does it work? Within the MARM, when it is undertaken, is there good engagement with other partners? We've had feedback that some people felt that they weren't always thought of, they weren't communicated with, or they weren't given the opportunity to attend because they weren't necessarily statutory partners. And this is a multi-agency meeting, as Kate demonstrated within her example, where everybody who is touching that person's life and might have information should be attending. How does the process link with other complex patient meetings, such as the high intensity service user meeting, or what we have in Somerset is something called a creative solutions board, which is a meeting for complex patients who are homeless and have a complex presentation. Where are the links to these other meetings? Is there any training available in your area relating to your guidance document, so that you can share that with staff when they're first using it to build their confidence in the process? Is it clear within your guidance document around the identification of a lead agency within that first MARM meeting? And is it clear that that lead agency role is reconsidered within future meetings? So always the right person, the most appropriate person, is coordinating the future meetings. Is it clear around how the individual you're worried about is involved in the process? Does the documentation lend itself for that to be clearly recorded, and also that clearly record the views of that person, advocate? Does the guidance or the policy make it clear that you have agreed actions? Who is responsible for those actions? When are we expecting those actions to be completed by? And is there a planned follow-up to review those actions in subsequent meetings? Furthermore, does your policy and guidance make it clear about who is the owner of those actions? And does the documentation clearly facilitate the recording of that? Within your guidance, are there clear processes about who records what information? Where does that information get stored? How are the minutes distributed? Who does the administration from one meeting to the next? Is it also clearly articulated about an escalation process? Now, that might be because you're not getting the right people attending the meetings, or actually that you have disagreements within the meeting that can't be resolved. Is that escalation process clearly linked within your guidance, and does it work when it's been needed? Again, consider the point that we've made in the previous slide. Is there any way that you can capture how MARM is being used? Is it something that you have in place but is used infrequently? Or is it something that you are able to audit effectively? Can you measure its effectiveness? Is the board providing feedback on how well it's being used? And finally, how does it link in with other multi-agency processes like MASH, if you do have an adult MASH? We're just going to finish on this slide because we wanted to have a little bit of time for discussion and feedback from you as members within the audience of your experience. So on the final slide, we've just put the 6 principles of the Care Act, but we've put it in a way where we want to make sure that it frames the question of how do we listen effectively. And our work is all about supporting and working with somebody that we are worried about, that may need safeguarding, and we need to consider their views throughout the process. So considering the 6 principles, we want to think about the empowerment element, which is where people are supported and encouraged to make their own decisions and informed consent. What we want to hear is that the person is asked what they want as the outcomes of the process, and that is directly informing what then happens for that person. Within the prevention space, which relates to taking action before harm occurs, that the person receives clear and simple information about what the concern is, what the signs are, and what they can be doing to seek help. Proportionality links to the least intrusive response appropriate for the risk supported, so that the person feels that professionals will work in that person's best interest, that they only get involved as much as is needed, and they are truly listening to the needs and the desires of the person that they're worried about. The protection element, which is about providing support and representation for those greatest in need, that the person can say that they feel that they get the help and support to report any abuse, that they get to take part in the safeguarding process to the extent to which they want to and to which they are able to, and the importance of having somebody there to support them if that is needed. The partnership element is around local solutions through services working with their communities. The communities have a huge part to play in preventing, detecting, reporting neglect and abuse. And this bit is where we're thinking and clear that the individual feels that they know the professionals treat any personal and sensitive information in confidence, that they only share what is necessary. The individual is confident that the professionals will work together to get the best results for the individual. And finally, accountability and transparency in safeguarding is that for the person that they feel that they understand the role of everybody involved in their life, and so do they. So what we want you to consider, or what we'd like to hear from now, is from anybody that's prepared to share their experience of what MARM or their similarly named process feels like and works like in their area. Has anybody got anything that they would like to share? Oh, a room of over 70 people and nobody's got an experience of MARM. Ah, Angela, thank you.
I just thought I'd say that I do have experience of MARM. I chaired a MARM meeting for the first time last week. It was within a community hospital. It was a really good. I felt the the guidance that I had paperwork wise was really helpful. And I felt it was a really good meeting. It was disappointing in that a lot of professionals didn't come along to the meeting. They came in on Teams, and that was difficult for the person that was the subject of the MARMS. But and I think that's something to consider going forward. If I were to chair another one, I think I would have further discussions with other professionals if that's the way they say they wanted to attend, obviously depending on who the person at the centre of the MARMS is. But yeah, I felt it was a useful meeting. It really involved the client and his friend who was also there. And yeah, it was good.
So will you hold another meeting?
Yes, there will be a follow-up meeting.
And are you based in Somerset or another area?
I'm in Somerset.
So from a personal perspective, your feedback about holding virtual meetings, that is something that is not already articulated within the document. So if I could ask you to fill out the evaluation form to capture that, that would be really helpful, because that's exactly what we're talking about around how you capture and listen to practitioners to make sure that we're putting all the right guidance. It's really good to hear that it was a really helpful process. But that's really, really useful feedback. So thank you, Angela.
Okay. Thank you.
Do we have anybody from any other area that might want to share their experience, or whether they have a similar process, and does it work effectively to listen to all those engaged?
Hi, I'm Kathy, Safeguarding Adults Officer from North Somerset. We do have a MARM process. We've talked about it in our team meetings, but I haven't used it yet.
Is that because is it new?
Yes, it's fairly new.
Okay.
And honestly, I didn't think anybody could set it up. So that's my learning away from this.
Well, I suppose, I suppose go on, carry on. Sorry,
the
you carry on.
case that you cited as good practice, I've had several very similar cases where the safeguarding process didn't really work because of non-engagement. And yeah, so it's made me think about doing that differently again in the future.
I was just going to say, I suppose it depends on what your local process says, but if it's going to be a truly effective MARM, then it should be a process that is led by any agency.
Yes.
So I suppose that's the ask back to you, is to check your local guidance and see whether it is actually recommending that it's a process that can be called by anybody, because it should be.
Okay, thank you. That's good
okay.
to know.
Thank you. Amanda.
Hi, yeah. I mean, I won't, I've been involved in MARMS, but I guess some learning for me recently was quite a complex case that we had where when they were open for Section 42, and so obviously what I didn't realise, adult social care were running their adult at risk meetings because they were open under Section 42, but I didn't realise that we could still run the MARM process alongside that. That was learning for me.
And we've got Daniel on the call from the local authority, and that was one of the points that he wanted to make very clear, that just because a Section 42 is being undertaken, that the MARM still has a very key process to play in that ongoing risk management. So thank you, Amanda.
Okay.
Thank you. Do we have any other experiences from across the region? So we've had North Somerset and Somerset. Do we have anybody from Bristol or Devon, Cornwall? Silence. Well, all I can say is, in lieu of any other comments, is that the conversations that we had across the southwest did cover from Cornwall across to Dorset and up to South Gloucestershire. There was a lot of inconsistencies in what the process was called. There was one agency, I think it was Dorset, that were in the process of introducing this as a mechanism to support practitioners in listening to it effectively to each other. So if you're not aware of the process and you do sit outside of Somerset today, then please do go back and find out what is in place for you as practitioners and how is it promoted. And I think the other point that I will take away as well is making sure that we provide some localized training around how to run a meeting, the hints and tips around what makes an effective meeting, to support practitioners and give them the confidence, because that's the most important thing, is knowing that anybody can call this meeting, and just because you call the meeting doesn't mean that it's your responsibility moving forwards to manage the process. It's a multi-agency process that enables us to listen effectively to each other, to listen effectively to the individual that we're worried about, and it's a process. It's something that we are working constantly to improve within Somerset. And if you live and work outside of Somerset, it's important that you find out how that works for you in your area of practice.
I think, Julia, it's worth mentioning as well that the MARM process can work alongside the resolving professional differences process in a positive way rather than a challenging way, to raise awareness of how we all work together and understand how other agencies work. I think sometimes with resolving professional differences, they often occur because there's a lack of understanding of the parameters within which multi-agencies are able to work, and a forum to enable people to sit together and kind of break that down and work together and understand how we all kind of fit in terms of providing that safeguarding support is really, really valuable. And this process adds to that, doesn't it?
Yes, absolutely. Yeah. Okay, do we have any comments or any final questions? Oh, Natalie.
Yeah, just to say, if people would kindly fill out the evaluation form, be much appreciated. It should only take a couple of minutes, and the link is in the chat, please.
And the slides are going to be shared as well. You've taken a list of emails.
If you would like the slides, lots of people put their emails on already. If you would add your email to the chat, please.
Okay.